An overview of feline dirofilariasis by Virginia Jeske at the University of Texas at Tyler. Dirofilaria immitis is a cylindrical white nematode spread by mosquito vectors and is known to cause cardiopulmonary dirofilariasis within felines. This disease is better known as heartworm disease. Although canidae are the definitive hosts, felines present as atypical hosts. Feline susceptibility is approximately 5 to 15% of susceptibility within canines in the same geographical vicinity. However, heartworm disease within felines manifests itself differently than canines. Resistance to heartworm disease is more prevalent within felines than canines and may result from genetic variation within species' immune systems. This is indicated by low adult heartworm burdens of 1 to 3 worms, shortened heartworm lifespan and patency, and low presence of microfilaria or immature heartworms. As this disease is spread by mosquitoes, it is logical to think that the indoor felines would be protected from contraction of the disease. However, a study in Spain showed that 32 of 56 indoor felines tested positive for heartworm disease via serology, indicating that mosquitoes frequently enter homes. Yet, as thought, heartworm disease prevalence in strictly indoor felines is decreased as compared to indoor-outdoor or completely outdoor felines. Moreover, aberrant worm migration of L4 larvae is more prevalent within felines than canines. A case study conducted at the University of California Davis Veterinary Medical Teaching Hospital revealed a 4-year-old feline presenting with right pelvic limb paresis, which upon ultrasound and echocardiography exposed a heartworm extending from the caudal abdominal aorta into the right femoral artery. The life cycle of D. immitis is crucial to understanding infection within felines. A mosquito vector must first carry microfilaria ingested from a canine by feeding upon the host's blood. Within the mosquito, microfilaria undergo 3 molts, from the L1 phase to the L3, requiring approximately 8 to 17 days' time. However, maturation within the mosquito is temperature dependent, producing variants of L3 larvae. Within the L3 phase, microfilaria are infective and can be transmitted to their new host through the saliva of the mosquito vector. L3 microfilaria migrate through the subcutaneous, adipose, and/or skeletal muscular tissues and molt into the L4 stage within 9 to 12 days. After a 50 to 60-day migration, L4 molts into the final immature adult L5 stage and enter into the caudal pulmonary arteries. Most immature adults are cleared by the immune system, but few may continue maturation into full adults over the next 99 to 152 days. Reproduction occurs 7 to 8 months after the initial infection. Sexually mature females release L1 microfilaria into the bloodstream, initiating a new cycle. Whereas canines can sustain large parasitic loads, felines typically sustain an average of 2 to 4 adult heartworms per cat. Furthermore, adult heartworms live only 2 to 3 years within felines, in contrast to the 5 to 7.5 years within canines. Suppression of fertility and viability from the high immune response of the feline host may result in heartworm clearance. Pathophysiologically, heartworm disease exists in 3 stages. Stage 1 is characterized by the arrival of immature worms within the pulmonary arteries, producing acute parenchymal inflammation. At this stage, symptoms are often subclinical. During heartworm maturation, immunosuppression occurs within the host. Stage 2 is characterized by the death of adult heartworms, heightening inflammation. The final stage, stage 3, involves permanent lung damage, type 2 alveolar cell hyperplasia, and/or chronic respiratory disease. Overall, feline inflammatory response due to heartworm presence is much higher than that of the canine. The smaller size of the feline pulmonary arterial area as compared to canines results in lessened collateral circulation and increased complications. Many felines with heartworm disease present asymptomatically, where 79 to 82.4% possess high immune systems that are intolerant and clear the disease without outside assistance. Most common clinical symptoms presented include coughing and dyspnea, but unique symptoms such as vomiting and neurologic signs can be seen and may be related to aberrant worm migration. Caval syndrome, although rarely seen in felines, strongly dictates prognosis as high worm loads present within the vena cava and right atrium and ventricles, interfere with tricuspid valve closure, and lead to heart failure. Heartworm-associated respiratory disease, or HARD, in felines is a pulmonary disease initiated by the appearance and death of L5 immature heartworms approximately 70 to 90 days after initial infection. Furthermore, HARD may be referred to as pulmonary larval dirofilariasis, as mature adult heartworms are never present. Previous studies have revealed presence of radiographically and histologically evident pulmonary arterial lesions in antibody-positive felines without mature heartworm presence. Clinical symptoms include, but are not limited to, coughing, wheezing, vomiting, dyspnea, and tachypnea. Cytology of hard-carrying felines reveals presence of eosinophilic bronchoalveolar lavage fluid, or BAL. However, BAL is also present within felines carrying mature heartworms. In addition, respiratory asthmas present similar symptoms, and BAL cannot rule out these diseases. Thus, conclusive diagnosis of HARD proves difficult. In addition to HARD, Rholbachia pipientis is a gram-negative endosymbiotic bacterium found in correlation with D. amidis, present in small animals and also present throughout all stages of heartworm development. Research conducted by Lee et al. Indicates that W. pipientis increases survival and fertility within heartworms, as well as aiding in sex differentiation. Throughout molting and reproduction and death, W. pipientis are released into the bloodstream, significantly increasing feline immunoglobulin G antibody immune response and heightening bronchoconstriction. Research of cycline family antibiotics used in conjunction with preventatives has not revealed significant improvement within felines. Thus, no treatment plan has currently been recommended for heartworm-positive felines in correlation with W. pipientis. Several options are available for feline dirofilariasis diagnosis. However, as a result of feline immune response, diagnosis proves difficult. Whereas prevalence of microfilaria within canines is indicative of a definitive heartworm diagnosis, heartworm-positive felines often present false negative results as a result of shortened heartworm patency. Nonetheless, several diagnostic techniques utilized together reveals higher sensitivity and specificity for dirofilariasis diagnosis. Studies have revealed conflicting results when utilizing thoracic radiographs for diagnosis. Prevalent left caudal pulmonary enlargement found within the ninth intercostal space, defined as 1.6 times larger than the ninth rib, has been observed in association with heartworm-positive felines. However, findings through application of thoracic radiography are often transient or specific to diseases such as allergic bronchitis or asthma. Furthermore, the absence of radiographic findings cannot exclude positive diagnosis. Echocardiography is an ante-mortem technique which can be used in addition to other tests, producing improved specificity. Heartworms appear as double-line echo densities similar to train tracks within the pulmonary arteries, right ventricle, or right atrioventricular junction. With a sensitivity reported as 88 to 100%, echocardiography, although dependent on expertise in heartworm maturation, can be considered a semi-reliable method of diagnosis. Serologic immunodiagnostic methods such as antibody and antigen ELISA testing produce the highest specificity when testing heartworm presence within felines. While antibody testing is more sensitive and less specific, antigen testing has a specificity of 100% and an average sensitivity of 77%. In addition, both types of testing may produce inconclusive or false negative results due to worm maturity, sex, and load. Antigen testing rarely produces false positives, such that positive results are typically indicative of a current disease. A true negative result is useful for ruling out heartworm disease within felines exhibiting heartworm-like symptoms. Previous studies have indicated that concomitant antigen and antibody testing provide conclusive results. Lastly, necropsy is the only definitive method for heartworm disease diagnosis. Proper necropsy should focus within the right ventricle of the heart and pulmonary arteries. Heartworm presence may also be difficult to locate as fragmentation may be present. This method of diagnosis is also important to the understanding of asymptomatic cases. Treatment of feline dirofilariasis varies depending on case. Medical care of heartworm diseased felines is most often presented as symptomatic therapy. Surgical removal, reported safer than chemotherapy, is a necessary action with cavul syndrome presenting felines. Furthermore, surgical removal is considered when aberrant migration negatively affects a feline. However, it may include risks such as vascular hemorrhage or fatality. Spontaneous recovery is possible in felines presenting asymptomatically. Thus, in this situation, a hands-off approach is recommended. In cases of hard or increased inflammation, steroids, prednisolone, or prednisone can be given in diminishing dosages with successful results. Lastly, monthly macrocyclic lactone preventative, a broad-spectrum endoparasitic and ectoparasitic preventative, should be established to prevent residence of future adult heartworms. Prognosis of feline heartworm disease is dependent upon disease severity. However, despite heartworm disease, heartworm-ridden felines are found to survive longer than heartworm-negative felines diagnosed with hypertrophic cardiomyopathy, chronic renal failure, or neoplastic diseases, although the probability of death does increase with age. Prophylactic treatment, especially within endemic areas, reveals the best prognosis, as contraction of heartworm disease via preventatives is prevented altogether. In conclusion, the occurrence of feline dirofilariasis is uncommon compared to that of canines, although this may be contributed to inconclusive, nonspecific diagnostic techniques. Treatment, including steroids and preventatives, may prove successful. However, high immune response or resistance in tandem with time may offer a self-cure. Prognosis is dependent on the severity of the case. Although understanding and treatment of this disease has varying outlooks, public education of feline dirofilariasis is crucial to the prevention and well-being of felines worldwide.